We will begin. I think our first is child welfare reform, state of Maine, and we're going to have Governor Baldacci and Christine Casella.
Thank you very much. Thank all of you very much. It's an honor to be here, but it's more of an honor just to stand and be able to talk about a program and initiative that has really done well for Maine children. In 2001, the tragic loss, thank you. In 2001, the tragic loss of a child in foster care shed light on a system that was failing children and families. Importantly, the response was to take a real hard look at our entire child welfare system. Looking at the data, we found that systematic change was required. Children were taken too easily from their homes, put into group and institutional care too often, and then forgotten. The culture needed to change. We had to put children in the state care first. The results have been dramatic. In every measure of child welfare, we're making significant progress. Children are safer and they're placed earlier and more often with families. Fewer children are in foster care systems, and of those who are, there's been a 67% drop in residential care. Savings from reduced residential care has been invested in community supports. Placements with relatives have increased, and in 2003, an estimated 360 youth were placed with relatives. In 2008, the number was 508. In fact, families are part of the process from the beginning. Through family team meetings, children and their families have a voice, and the needs of those children are clear and paramount. In progress, system-wide is tracked to improve management and the outcomes. Maine leads the nation in the percent of reduction of youth in foster care. Determination, perseverance, and passion for social justice for children was part of the process from the beginning and remains in place today. We are proud of what we've accomplished, but we're not resting on our laurels. And I'd like to have Christine Casella, who's now going to give some remarks. Christine.
Thank you.
Good afternoon. My name is Christine Casella, and after a near-fatal drug overdose, I became a mother involved in child welfare. My infant daughter was removed from my custody and placed with my mother for a period of 10.5 months, and during that time, I experienced firsthand Maine's achievements in child welfare reform. The worker handling my case never failed to be overwhelmingly supportive, encouraging, compassionate, and above all, respectful. Excuse me. I had regular and timely family team meetings where my voice was always heard and was a driving force in the decision-making process. No decision was ever made without my knowledge or input, and I experienced firsthand the no decision about a family without a family philosophy, and it made a tremendous difference. Despite numerous cases and what I can only imagine to be an incredibly daunting workload, I never once felt as if my case, my family, and my future weren't important. Myself, my daughter, and her father were visited frequently and were shown a genuine invested interest in our success. My former worker still refers to my daughter as our little girl, and our family shares a very special bond with her today. During the duration of my case, special attention was always given to bridging and maintaining our family ties and strong support systems to ensure our success long after DHHS involvement. And due to equal parts, my own hard work and the department's dedication to quality and family-based service, today my family is intact, humbled, sober, and stronger than before. As a direct result of my positive experience, I was inspired to mentor other parents through our Community Partnership for Protecting Children's recently implemented Parents as Partners program. Our goal is to be an abundance of support and experience for the parents we serve in effectively helping them move through their case. It would be a grave understatement to say that this job is much easier now than it ever would have been before this reform's inception. And in conclusion, today and every single day, I look back on my experience and think not that I was shortchanged by the system or that my life was ruined by the stigma of child welfare, but rather that I needed help and DHHS was there to give it, and to give it in a non-judgmental, respectful, and supportive way. And in my eyes, they are not the enemy, rather a trusted ally in my and my family's continued success. Thank you.
Well, thank you very, very much. We don't often hear that from people who had their work with the child welfare system, and that's a terrific story. I don't know if there are any questions from our group. Yes, David.
The site visit report mentioned that Maine is experimenting with measuring child progress through use of the Child and Adolescent Functional Assessment Scale. So I guess that's measuring the well-being of children who are in the system. But we didn't receive any data about that. Do you know anything about how those indicators are trending?
If I can just take 1 minute and then get into the answer that's laid before me here in response to that, the research that's been done to this point. My wife and I work with a homeless shelter for teenagers in Bangor, Maine, and they had done a study to determine about teenage homelessness and the factors that complicate a young person's life. And the study was basically that money was part of the answer, but it wasn't the whole answer. It was trying to connect children to their families quickly within the first 30 days, prevented the child's decline into prostitution, drug use, and incarceration. And it was key to get the child acclimated to their family in a short period of time. But the problem was all the government programs and services are awkward and don't talk to each other and can't be able to be like a laser beam on that problem. So that early research in my head was that the closer and more connected that the children are to their families or extended families, the better that it is for them, for their livelihood, and for their future. Now, into this initiative, we were being sanctioned by Washington because we had too many children in residential care. And in fact, Maine was out of sorts in regards to federal standards, so we had to undertake this initiative. And it made sense to do it anyways. It made sense from a budget impact, but more importantly, it made it for the child's livelihood and well-being. Now, getting to the research demonstrates that children in residential care, as compared to those in foster care, have much higher rates of incarceration. Research also demonstrates that children in residential care have worse educational outcomes, permanency, and other outcomes than the kinship care or foster care. Subsequent maltreatment or reentry into care is less than 5%. An array of home-based services have documented improvements through standard measures called CAFAs. Youth tell us they do better out of residential care, and we have no documented incidences of youth running back to residential care. It's all very early, but that's the early research that we have today.
Carl?
I have a Governor, thank you very much for your remarks, and also Ms. Casella for yours. And your story particularly is very compelling. But you started, Governor, by talking about how this was triggered by a death of a child who was under the jurisdiction of the state. And in a similar vein to David's question, I just wonder what the data is since Maine has implemented this program on the number of children who are under the jurisdiction of the state who have died compared to previously the number of children who are aftercare, have been in incarceration compared to previously, and the like. Is there any data on that?
Let me just ask Jim Bear if I can see Jim here. Yeah, Jim. Zero. In 2001 was before I became governor.
Thank you.
Thank you.
And it's very impressive that the governor has come to talk to us about it, and that your own passion comes through so clearly. What do you see would be the next 2 steps you'd like to take in this program?
I think, to me, I think that we have got to follow this along. There's no question that we started from the ground up, so we need to follow this along, and we need to make sure that there's no boundaries, because listening to Christina, you understand the opportunities to really light one candle rather than curse the darkness, and to recognize what we can do when we work together. I think that government, when we talk about reinventing ourselves, we've got to recognize that the awkwardness of our programs and agencies and bureaucracies get in the way of each other and don't communicate as well as they should. And I really think that there needs to be a change. Rather than people changing, I think governments need to change in the way they do these things. And we ought to look at this as a way to recognize it is about resources, but it really is about our lack of effectiveness with working with each other. Federal, state, local, all of us together. The focus really does need to be on the child, and to have the test and benchmarks be on the outcomes of the child.
Well, thank you very much. I have to say in the site report, what they were very impressed is how this system in Maine had become very family friendly and believed that families had strengths, and that if you work with them, they could respond. And so that fits in with what you've said and what you said so eloquently, Christina. So thank you so much for joining us and trekking down from Maine. We appreciate it.
Nice to see you, Bill. We'll see you later. Thank you, David.